So I'm planning to do a series of posts on the various anxiety-related problems. And today, I'm starting with the easiest of them, specific phobia, which used to be called simple phobia in previous versions of the diagnostic manual. They changed the name because I think that these phobias aren't necessarily quite so simple. Calling them simple implies that they're really not such a big deal, but they can become completely disabling. I remember a person from many years ago who had a fear of frogs. Now it's tempting to think, well, big deal. You just avoid fish ponds. Done. But in fact, in this person's case, it was a big deal. The more you try to avoid the things that scare you, the worse the fear tends to get. This person had been afraid of frogs for many, many years, and they had managed the problem through avoidance, like most people do. As a result, it had gotten worse and worse. At first, yeah, sure, she avoided fish ponds, then any place out in the wild, then any place outdoors at all, and she wound up almost housebound. Now, there are all kinds of specific phobias, and you've probably seen lists of their names. Triskaidekaphobia is the fear of the number 13, stuff like that. The truth is, most clinicians don't know those names any more than you do, because they don't matter. Nobody cares. Labeling a problem is the cheapest and most useless form of explanation. So knowing that ophidiophobia is a fear of snakes doesn't really tell you much. It's just trivia, right? It's irrelevant. Again, nobody cares. Okay, you can develop a fear of just about anything, but there are a few common categories. Animals, for example. Spiders, dogs, cats, bees, rats, birds, sharks, and so on, right? Other people are afraid of some aspect of the natural environment, things like heights, or thunder, or darkness, or water. Some people are afraid of specific types of situations, like flying, or riding in an elevator, or driving. Others have fears related to medical issues, like seeing the dentist, or getting an injection, or the sight of blood. I may talk about that last set in a separate video because there is some very particular bits around blood injury phobias that deserve some special attention. Now, maybe you have a phobia of some kind yourself, right? There's something that activates fear in you that doesn't for most people. And maybe it's severe enough to count as a genuine, specific phobia. Or maybe it doesn't. Most people, if they think hard enough, have at least a bit of excessive fear about something, right? It's a normal part of being human. So what are the main features that lead to a diagnosis of someone having a specific phobia? Well, the first one is pretty obvious. Excessive or unreasonable fear that gets triggered by a specific object or situation, or by the belief that you might be encountering that situation in the near future. So you're frightened, let's say, by the sight of frogs, but also by the idea of going to a swampy frog sanctuary. Next, the fear reaction has to be way out of proportion to the actual danger, and it has to be pretty immediate. So the dog doesn't have to bite you, it just has to be there, and you get fearful the moment you see it. Then there's something that's a matter of some debate. Do you have to realize that the fear is irrational? In the past, this was an absolute must. If you honestly believe that that dog has rabies, the fear does not count as a phobia. If you really do believe that that bridge is about to fall down, it's not a phobia to be fearful of walking across it. In the most recent diagnostic manual, this is not absolutely essential. Now, why they made that change, I don't actually know. Most of us still think that at some level, you have to know that this doesn't make sense. The frog is not going to eat you. You know that. But sometimes people have a fear of elevators, for example, And they really do think that they would suffocate if the thing got caught between floors. Now, realistically, that doesn't make any sense because obviously nobody makes elevators airtight, right? Doesn't happen. But sometimes the person just hasn't thought through their reasoning. So maybe it's okay to include those people anyway. Next, the person has to go to great lengths to avoid the thing that they're afraid of. Or if they absolutely can't avoid it, they'll endure it, but only with a lot of distress. So they might walk an extra mile to get away from the dog park. Or they might give up friendships with people who live on the other side of that bridge that they don't want to walk over. And the problem has to have a significant impact on their life. So if you're afraid of snakes, but you live in Vancouver, where there are practically no snakes, you can pretty much have a normal life. So it doesn't really count. But if it means you can't have a job above the second floor, or you can't go outside, or you're screaming in fear every time there's a thunderstorm, we got an issue. This is the one that weeds out most of us. You probably have a couple of irrational fears, but okay, not liking spiders is not ruining your entire life. So, like all anxiety disorders, specific phobias have two main components: anxiety and avoidance. And as I said in another video, it's usually the anxiety that we focus on and want to get rid of. But the more we focus on our anxiety, the worse it usually gets. In treatment, we tend to focus more on the avoidance. And if we can overcome the avoidance, the anxiety will get less as well. So it's an odd thing. If we focus on the anxiety, both the anxiety and the avoidance tend to get worse. If we focus on the avoidance, both the avoidance and the anxiety tend to get better. So what do we do about these things? Well, first, there's that question of whether you think the danger is real or not. So usually a therapist working with you will explore your thoughts on the matter. How likely is it really that your plane is going to crash? I remember a person who said, no. I know that the odds are it's not going to crash, 10% or so. Well, listen, if there's a 10% chance your plane is going to crash, don't get on it. Right? This person was still hyperinflating the likelihood of a bad outcome. We had to start with some work on the actual odds. We looked at how many commercial flights left the local airport every day, and then how many of them actually crash. In Vancouver, that would make at least 10 crashes a day. The reality is we haven't had one in decades, at least not big airliners. So we at least need to get the intellectual knowledge that the fear is unrealistic. Your gut may still be saying, no, it's going to crash, the bridge is going to fall down, the poodle is going to kill me. But at least intellectually, we need you to realize that it's excessive. But doing that does not take the problem away. Never. At least not in my experience. So the main thing we need to do is to focus on that avoidance. And in upcoming posts, I'll show you how we do that. But keep in mind, YouTube is not psychotherapy. I have never met you, and I don't know anything about your issues if you have one. So you cannot take this as a substitute for care from a registered healthcare provider. I won't even be giving you the detail that you would get in a standard self-help book. So if you're dead set on learning more before you seek help, consider reading a good book on the subject. Here are a couple of options. The Anxiety and Phobia Workbook by Edmund Bourne. This is a classic that covers a lot of the basic ideas involved in overcoming a wide variety of types of anxiety. Also, Overcoming Specific Phobia, the Client Workbook by Edmund Bourne, again, and by Matthew McKay. And Conquer Your Fears and Phobias for Teens by Andrea Kettling. Now, there's nothing very specific about phobias in teens, so the information is going to be pretty similar to that for adults. Feel the Fear and Do It Anyway by Susan Jeffers. This is another classic, right? A great book on the idea of diverting away from a focus on the anxiety and onto the real culprit, the avoidance. Okay, so in coming posts, I'm going to talk about some of the types of work that we do with specific phobia and other anxiety disorders. If you're afraid of frogs, I'm not going to do a post just for you. But many phobias are roughly similar in approach, so you get the idea. And if you work with a professional, knowing about this may help speed things up.